Did you know that over 99% of cervical cancer cases are caused by just one thing?
That's pretty incredible when you think about it.
It really is. That single cause is HPV, the human papillomavirus.
Exactly. And that leads us straight into our deep dive today. We're looking at why the shot, often called the cervical cancer vaccine, really should be known as the HPV vaccine. We're drawing from a physician's explanation, simply titled, Cervical Cancer Vaccine Must Be Correctly Named HPV Vaccine.
A very direct title.
It is.
Yeah.
So our goal here is to unpack why that name matters so much and, what this vaccine truly protects against.
And the starting point is that almost absolute link, like you said, between HPV and cervical cancer. The vaccine works because it prevents the HPV infection itself.
Okay, so stopping the virus stops the cancer, basically.
In essence, yes. For cervical cancer, that's the mechanism. But, and this is the crucial part for the naming discussion, it doesn't stop there.
Right, because HPV doesn't only cause cervical cancer, this vaccine's reach is wider. Much wider. The specific HPV types the vaccine targets are also linked to vulvar cancer, vaginal cancer, anal cancer, and even some cancers in the mouth and throat region, oropharyngeal cancers, tongue cancer, and penile cancer in men.
Wow. So it covers quite a range then. That really explains the push for the HPV vaccine name. It's just more accurate.
Precisely. It reflects the full scope of protection.
So let's talk about HPV itself for a second. How does it actually, spread?
Well, the primary way is through sexual contact. We're talking skin-to-skin contact with mucous membranes, bodily fluids.
And it affects everyone.
Yes. HPV can set up shop, so to speak, in the mucous membranes and skin of the genitals and the oropharynx, that's the back of the throat in all genders.
Okay, but I read something interesting in the source. The body often fights it off.
That's right. In about 90% of cases, the immune system actually clears the HPV infection on its own, usually within about a year.
90% is high.
Yeah.
So why the vaccine then, if most people clear it?
Good question. The issue isn't the temporary infections, it's the persistent ones. If the infection sticks around for longer than a year, that's when it can start causing changes in the cells when it's living. And over time, potentially years, those changes can develop into cancer.
I see. So the vaccine is really about stopping those persistent, dangerous infections before they take hold.
Exactly. It's pure prevention.
And how effective are these vaccines? The source mentioned different types.
They're generally very effective. We're looking at preventing somewhere between 70% and 90% of HPV infections, depending on the specific vaccine and the HPV types it covers.
70 to 90, that's significant.
It is. The main one used now is the 9-valent vaccine. Valent just refers to how many types it protects against. So 9 types.
And these aren't all just cancer types, right?
Correct. It covers the major high-risk types that cause most cancers, but it also protects against HPV types 6 and 11.
And what do they cause?
Those are the main culprits behind genital warts, or condyloma acuminata. So you get protection against cancer and this other common, though less dangerous, condition.
Okay, that's a key benefit too. Now, timing. When's the best time to get vaccinated? The source emphasized getting it early.
Yes, ideally before someone becomes sexually active. Since the vaccine prevents the initial infection, it works best before any potential exposure to HPV.
And the recommendation starts pretty young.
It does. Age 9 is the earliest recommendation. And there's a good reason. Younger individuals tend to have a stronger immune response to the vaccine, more antibodies.
But what if someone is older or already sexually active? Is it too late?
No, not necessarily too late. While it's most effective before exposure, it can still protect against HPV types someone hasn't encountered yet. So even if you're older, have had kids, been sexually active, there can still be benefit.
So you don't need like an HPV test beforehand to see if you qualify?
Generally, no. Testing beforehand isn't usually recommended because the vaccine might still protect you from other types covered by it, even if you've already been exposed to one type.
Got it. And the schedule. How many shots are we talking about?
Typically, it's a series. For younger kids, say 9 to 14, it can sometimes be a 2-dose schedule. For older teens and adults, it's usually 3 doses over about 6 months.
And does it last? Do you need boosters?
The protection seems very durable. We know it lasts for at least 10 years, likely much longer. Right now, booster doses aren't recommended after completing the initial series.
What about pregnancy? Safe then?
Good point. It's not recommended during pregnancy, more as a precaution, but it's considered safe to get while breastfeeding.
And if someone gets pregnant, say, midway through the series?
They just pause the schedule, wait until after the pregnancy is over, then pick up where they left off to complete the doses. Importantly, studies haven't shown harm if someone received a dose in early pregnancy before they knew they were pregnant.
Okay, that's reassuring. So wrapping this up, the big takeaway really is, this isn't just about cervical cancer.
Not at all.
Calling it the HPV vaccine makes it clear it protects against a whole range of potential issues, from several types of cancer in both men and women to genital warts.
Exactly. Understanding that broader protection is key for people making decisions about their health or their children's health.
Which brings us to a final thought for you, our listener. Considering this vaccine prevents so many different types of cancer, not just the one it was initially famous for, how might a better, wider public grasp of these broad benefits actually change things? Could it impact public health approaches, maybe boost vaccination rates? Something to definitely mull over.
A really important question.
Thanks for joining our deep dive today.